good evening to all of you present here. And this series, Empower the Determined, is very, very close to my heart. And I am Dr. Alka, a licensed psychologist by the Community Development Authority. And I am extremely delighted to introduce you to one amazing personality in Dubai, and let us understand how she has dedicated her whole life to the cause of determination. Dr. Hibah Shata. A very good evening to you, Doctor. How are you today?
Thank you very much. It's indeed very day to be with all your esteemed guests and talk about my journey to empower people of determination. And I hope that they would be inspired and also help to support them in any way I can.
I know you're very, very passionate, Doctor, about it, but let me quickly take this opportunity to introduce our guest, a very, very honored guest this evening. And let me tell you, friends, that she, though is a dentist by profession, but she is an authority in the field of applied behavior analysis. She started her career at the Armed Forces Hospital. She also worked for the National Guard Hospital. So she's been working in the field of dentistry, and finally in Dubai in 2000, she even started cosmetic and functional dental problem solving under another establishment, a very prestigious dental clinic. But then the question is, where did ABA came in her life? She has lectured all over the world in the various national and international conferences, and she's presented her research work everywhere. She's attended a lot of workshops and symposiums, and she first company she launched was in 2008. It was co-founded, and the name of the organization is Child Early Intervention Medical Center. In 2010, she co-founded the Child Learning and Enrichment Medical Center, and then started a beautiful concept of Maharat Learning Center in Dubai, and then eventually in Riyadh, the Kingdom of Saudi Arabia. The journey is eventful, but recognitions are mind-blowing. If I start reading her list of recognitions, believe it, 30 minutes will go in that. I will quickly keep you introduced to her very, very important recognitions, which includes that she's been 50 fabulous innovative leaders at the World Innovation Congress. She has already won the Sheikh Khalifa Excellency Award. She's been the Cartier Women Initiative Laureate for Middle East and North Africa. She's been Distinguished Women in the Healthcare in 2019. She has won various awards by DHCC, DHA, and Global 100 Women Leadership Awards, 100's Most Sustainable CEO Awards, and whatnot. The list goes on and on. We are so delighted to have you with us, Dr. Hibah. And let me start this journey. I know you've been doing amazing work in Dubai, but let me understand, you have been a dentist by profession. How did you actually got involved in autism, and you've done a fantastic work in this field? So can you please help us understand that?
First, thank you very much, Dr. Alka, for such a beautiful introduction. Really, you made me feel so proud. The journey in dentistry, I come from Saudi Arabia, and I was raised during the 70s, where women at that time study just for the sake of having a certification, but really the goal is to be a housewife and focus on raising your children and have a family. So not in my wildest dream, I was dreaming of where I am today. Most of our friends at that time had married just after school or a little bit after college. I studied dentistry, and then I pursued with my master's in London, and then I did my fellowship from Royal College of Surgeons. I came back, I did many hospitals. And in 2000, I moved to Dubai with my husband, and we established my dental clinic. And just in the time when I wanted to expand that clinic, I studied with the University of Dubai. I did a diploma in business management. And in 2007, my daughter was diagnosed with autism. And she was 1 year and 3 months. I looked for services because I read a lot, and I read that early intervention is very important. A lot of children who start as early as 1 year, they will end up, out of autism. But unfortunately, at that time, I couldn't find any services for such age. Any center would not take a child before the age of 3. Most of the services were overcrowded with waiting lists, so I couldn't find anyone to work with her. And at that point, I had to stand with my husband and think what we can do. Can we do anything here, or shall we immigrate to America or Canada, where the services are well established and mature? And we took a decision to stay and try to help her and help other kids like her. So I started Child Early Intervention Center at that time. And the concept of ABA therapy was very new. Nobody knew about it, but it was very popular in the States. So we hired an organization, one of the leader organizations in the States, to come and oversee the programs for the children. And this is how we started the journey. In 2010, we had few kids ready for the schools, but the schools were not ready for them because school inclusion concept was not mature yet at that time. And we did a survey, and there are families who went 16 and 17 schools before they can find one to accept their children. Others, they were not successful at all. So this is when I started Child Learning and Enrichment Center, a school-like environment. We called it an alternative education center. So basically the child would come, sit down, get academics, because most of the programs that were available at that time did not have any academic, like teaching the child to be integrated in mainstream school. So a few years on the road, we had a lot of kids integrated into schools, but I also had to do something to make schools accept these children. So we started a campaign called I Want to Go to School campaign. And we got together with the Ministry of Health, Ministry of Education, the KHDA, and we sat together and discussed how can this happen. And we focused on training because we knew that the teachers are reluctant to accept the children because they are scared. Who will support the child? What am I going to do? How can I add him to the classroom without having extra time to spend with him? So we came as a center to relieve all this. We trained teachers to create the IEPs, how the curriculum modification, how to manage the behavior. And we got involved. We were there to support them. We were doing the shadow teaching, or if they had a private, we would train that shadow on the IEP. We monitor the child's progress.
Good to see.
This is how we made it happen.
I just wanted to know I just wanted to know that yes. Why did you feel that behavior therapy is important? Like out of all the options, you did focus a lot on behavior therapy.
Yes, in the United States, it's one of the most evidence-based practice for autism. And it is researched since the 50s and 60s. And there has been a lot of papers saying that 40 hours of ABA therapy per week will really, 50% of the children will no longer need services as they grow up. And it's true, my daughter now is 15 and most of her programs at the moment are focused on life skills, independency, socialization. When she was much younger, it was different programs. And I'm sure you will ask about this in a minute.
Certainly, Dr. Hibah, because you are a mother yourself and you are a parent of a child with autism. And I know that your daughter is doing amazingly well. I would like you to give a message to the mothers, and particularly with reference to ABA.
Yes, I mean, a lot of people don't understand what applied behavioral analysis is. ABA therapy is based on using toolbox of techniques to motivate the child to learn. So it's based on rewarding good behavior, teaching the child an alternative behavior. So whether the behavior is excessive or deficient. So for example, if you ask the child and he doesn't answer you, that's deficient. If he is constantly moving, that's excess. So in behavior management, you have to tackle both problems. Either if the child is doing something too much or not doing it at all, we have to teach the child how to work with according to the programs that we set. every child will get about 25 to 40 programs that we have to update every 2-3 months. Once the targets are achieved, we move to the next program. Behavioral analysis teaches the child, it starts by teaching them self-help skills, communication, social skills, beginning academic skills. Once they are in school, we start to look at organization, school theory of mind, executive functioning. Once they are at teenage, we try to look at life and skills, how more sociable, because this is the time when they have to make friends. We also have to look at adaptation skills, because a lot of them find it difficult to adapt to the teenage and hormonal changes, these changes. And as they grow into becoming more senior in school, we start to look at transition to university skills, because here the student needs a different set of skills. He needs more to understand how to work in a different environment. He's not protected anymore, where he is working more adult students. And as they grow into job market, we also get involved into creating that environment, and also to help the people who supervise our determined at work to understand the problem, understand how to be able to work with the candidates or with the employee in a rewarding way, because this is how ABA work, is by rewarding. And the more you reward the person, the more positive energy and the positive things you can achieve.
Yes, rightly said. Dr. Hibah, I would want you to actually give a message to the parents of the children who have speech delay or who face serious communication delays. I'm sure that your experience is going to benefit them.
Well, first of all, number one is we have to accept whatever it is. I mean, the first thing that a lot of people goes into is denial. They will not accept the fact that the child doesn't speaking or he has a problem. So I think the first thing is to accept and start to look for a solution. Seek a good practitioner, get him to assess your child. Do not wait until he's 4 or 5. If he is 1 year old and he doesn't say one word, then your child has speech delay. And this is very important. I remember when I went to my pediatrician and I complained that my daughter does not speak. He told me, if you have 1% only doubt that she's different, you have to seek psychological advice. So it's very important that we don't wait until everybody tell us or the school come and tell you your child has a problem. If you notice you have anything that, especially if you're a parent for a second or third child, you will know. But if you're the first time parent, you have to look at developmental milestones. You have to educate yourself on what to expect at a certain age. And if it doesn't meet the criteria, you have to seek advice from your developmental pediatrician or psychologist or psychiatrist to understand where is your child in terms of his growth and development. Yes.
Very, very nice. Thank you so much. Thanks a lot, Dr. Hibah. Now, I know that you have a daughter and she's going to school. Share with us the challenges your daughter faces at school, and how does behavior therapy help her in existing in a regular school?
The challenge is that anybody, there are two types of challenge. I would divide it more of, there are challenges for the teacher and there are challenges for the parent, and then there's challenges that face the entire classroom. I would start by, as a parent, the first challenge is to find the right school, the right curriculum for your kid, and to have a good involvement of that school in your child plan. Be participant in the education plan, and the school as much as you can. As a teacher, the challenges are, how do I put an IEP plan that meets all the child's needs, academically and behaviorally? As a teacher, maybe I am challenged because I have a child in my classroom with a shadow teacher and I have to explain that to all the other students. As a teacher, I have to engage that student in all the children activity that I have, so he is not standing out. He has to be engaged. Also by the fact, or he would be a challenge for them to make sure that if the child needs to go out, he can go out. And without disrupting the classroom. If you have sensory issues, that these sensory issues are tackled within the classroom. As a school in general, the inclusion has to be part of their norm. It's not something that they are forced to do. It has to be within the system of the school, the policies, the processes, the acceptance, the criteria, how they support the student, how they support the teacher. So that's the responsibility of the school. So if you can see, it is challenging when a parent put a child in a school that is not engaged, is not involved into that student, that they just want him with the shadow, and the shadow is responsible for everything. And sometimes that is tiring because the parent today I just had a talk with a parent. She said, I keep on telling the teacher and the shadow teacher, but nobody gets what I want. So eventually the parent created cards for her child where he put all his emotions. I am happy, and it explains why he is happy. I am sad, I need a break, So she gave her child options to ask instead of engaging into behaviors where he disrupts the other students. So it's very important that this all together work as one unit. We can't have deficit in anywhere. The teacher have to be engaged, the parents engaged, and the school itself are all on the same page.
Rightly said by you, Dr. Hibah, because school plays a very, very important role, and the class teacher is the most significant. And I still see a lot of places where the whole role of LSA is not very clear. So what is the role of a learning support assistant? Because a lot of schools still have assistants which are not trained. So they do not even have the idea. And certainly a child who's looking for an escape or avoidance or showing the sensory issues should not be given a time out from the class. It should be handled right within the classroom. And they're very, very intelligent children. Now, I know that Maharat is launching a transition to university program. What can you tell about the center, and how do you support the community through Maharat Learning Center?
I'll just go a little bit towards the role of the learning support, because you asked that question. The learning support assistant is a person who is trying to be the middle person between the teacher and the child. Her role is to fade out over time. So when we start with 100% shadowing, but we have to fade that out to 20 to 50%, 25% until completely the child is receiving all his instruction directly from the teacher. And that is a very important essence of why we have a shadow teacher in the classroom. If the classroom teacher and shadow teacher are there, that support kids is even a better situation, because then there is a person to support all the other children as well. A lot of time we found that the teacher, especially if the child is crowded if the class is crowded with students, luckily now with Corona it doesn't happen, but when you have 25, 30 kids, it's very difficult for the teacher to engage with that child at any time because there are so many kids in there. So the role of the shadow is to explain to the student what he needs to do when the teacher asks. And it's not that she is responsible for everything. There are things that are responsibility of the teacher. So for example, the teaching material, the content, and then the shadow teacher is there to facilitate the learning process and tell the child, for example, if the teacher asks, bring your pen, so she will tell him, the teacher said, bring your pen, can you open your bag, bring your pen out. So she explains the instruction to the student. But still, the teacher is responsible to engage that student with other students. So she will have to put them into circles to work with other kids, give him tasks that he would have to do and take turns with other students. So he's part of the classroom activity. A lot of time the teacher with the modification, because we do a lot of curriculum modification for students, it's important that if the child cannot read, for example, that he have an option of using pictures or multiple choice questions or type if he cannot write. All these flexibility and adaptation and accommodation that are given to the student will lead to his success. He will still learn the same differently, but he will learn the same content, the same material, but in a different way. And I have been exposed to a very smart teacher where she had 20 students and 10 of them were having learning difficulties. So she had created a system where she had 4 sets of questions to suit each group. So she grouped them. There are the talented and very smart, and then there is the normal, and then there is so according to their level, she will put a set of questions in a way, so everybody is achieving, everybody is succeeding. And that was very smart. she have trampoline in the classroom, ball in the classroom, so everybody can benefit from the accommodation. So the special needs student does not stand out from the rest because everybody get a chance to play on the trampoline. So everyone is, you know, part of that, because that accommodation can help everyone as well.
Certainly, rightly said by you,
For the
that differentiated teaching programs make brilliant differences in the life of a children. And we've seen that accommodations are very, very significant. The minute the right accommodations are there and right recommendations are there, we can genuinely help the student achieve the desired result. It is lovely to see.
True. And also, yeah, and it's also a lot of students with learning difficulty are hidden. Nobody knows about them. They are there in the classroom. 40% of the students in one study had learning difficulties. So if you use an accommodation that will help everybody to calculate or help everybody to learn, it will be useful for more than one kid. I mean, many kids also will be successfully learning from the mindset. It's important that we talk about the attitude of the teacher towards teaching the children. It's very important that we are open-minded to trying new things, open-minded to try innovative ideas and see how it works with the students. Traditional teaching is difficult today, especially with the computer technologies and children getting bored so quickly. So we have to move to a new ways and smarter and more interactive and interesting way of learning. And sometimes teachers just have to assign tasks to the students, and they can go on Google and create a power presentation or play with Play-Doh and create the figures. So there are so many ways to teach, and then it's more about sharing what we have all learned together in the classroom. So everybody contribute with what he have learned, and then the whole class has, you know, achieved the same goal. When we talked about
by you, Dr. Hibah, that it is very, very significant that teacher actually uses differentiated teaching methods and involve each student, because each student is unique and
Sure.
is very, very special in their own strengths and their own limitations. And once teacher
Sure.
understands that, then she is certainly the best guide to help the children. Thank you so much. Tell us a bit more about Maharat Learning Center and how does it help the community?
I will go to the transition to university program because we skipped that a little bit. We have we have a lot of students who are now in high school, grade 8, 9, 10. Within 2-3 years, they should be moving to university. So we wanted to prepare them for university life. And this is a program we launched with the American University of the Emirates, where we would help children and students in the high school and middle school to get some experience on technologies, on design, and different topics in order to prepare them to what they would like to do in their future. We also have the SABIC Innovation Club. Our community involvement has started since 2008. When I decided to open the center, I realized that there is so much awareness we have to create because people didn't know what's autism. We had to change the mindset of accepting children who have behavior challenges in the supermarket or anywhere. So raising awareness, we run walks every year. We have a conference every year. We had workshops for schools and teachers. Talk in nurseries. We are engaged so much when it comes to engaging the community. Today with the COVID-19, we had to come up with a lot of other new solutions to help students working from home. So we have Mom is My Therapist program, where we know that a lot of parents no longer can afford to get therapy or cannot leave the house or take the child out because there are 3 other 4 kids in the house doing all online learning. So we have created the Mother is My Therapist program to help mothers implement the programs at home, whether she have help or alone. At least they have a program and they can start to work on the child with it. It's one-to-one. We have a remote supervision program that we have launched a few years back, but now it became more active because a lot of people outside cannot reach services, especially with some places where services are completely shut down during the corona. So we provide them with the online support as they need, and if they want provision, we do also the online ABA therapy. It is very difficult because you need to have someone working with a child and another end somebody's showing them how to do the program. But it worked. We had to do it because a lot of kids were locked in another country during holidays, and they still have to continue with their programs. And then we have the SAVIC Innovation Club, which we launched in August. And this is an innovation club that is open to students of all ages, but we have not launched it officially because of the COVID. However, now we are running the Saturday Club, where we are teaching students different technology like designing, creating web pages and things like that to see and probe where they can feel they are strong, and then we can run more programs to tackle their interests. We also have the, of course, the supporting employment program. We have mini masters, which is a small group of students to give them the interaction in between creating social skills. And we have also the, I talked about the mini masters. We have a program for the university students as well, to support them in the university. And I don't know if I missed anything. We have a lot of programs. We have also neurofeedback. We have a life coach to work with them, to teach them how to choose their career, how to work it out. And she would support both typical students or students with learning difficulties.
Lovely. Nice to know all the programs which are available there. I would like to know that what are those freebies which you offer as a community service, and what are these programs? Are these all for the community, or there are few?
For the community programs, now we are working with Special Olympics to run our sport program. Our sport academy, before COVID, we were offering taekwondo, swimming, and a lot of activity for students, but unfortunately all that has stopped. We're now trying to do the Special Olympics so that they can get to learn football, basketball, name it, horse riding, a lot of taekwondo, judo. There's a big list of 20 activities that they can go, from dance, music. So, and a lot of these will be free of charge. If it would be charged, then it will be very nominal figure, yeah.
And is it only for the children with autism, or is it open to all students of determination?
It's open to students of determination, but we do not do physical disabilities. Unfortunately, this is not our edge or skill. We work a lot with cognitive delays, learning difficulties, and autism, ADD, ADHD. And our programs are more to teach them how to think and understand and be, to be part of, and to be included into the community. Most of the people with physical disability have different needs and different support and accommodations that we do not provide. However, we do have Down syndrome also is one of the areas that we work with the children. For the activities that we run for the student at the moment, as I said, because of the corona, a lot of it is not happening because especially now the corona numbers are rising. So we're very keen about what we do and how many students. It's a very, very small group. We work within like maximum 6 students in order to make sure that we are very contained and very safe, and the number of students and teachers in the classroom are to the minimum. But we always open to new ideas and new things that we can, anything that helps the child to learn or help him to be happier is something that we are open-minded to do.
Wonderful. It's really, really nice talking to you, Dr. Hibah. I would also want to know that if there is a child who is not giving an eye contact, and the child is facing challenges, but the parent is into a denial mode, because early intervention, as you rightly said, makes a very, very big difference in the life of a child. And it is a very, very clear case, because the total eye contact is absent, but the parent is in a denial mode. What would be your message to such a parent?
We see that a lot. It's normal. Denial is one stage before acceptance. The first thing when somebody tells you your child has a problem and he's not going to be normal, or he's not going to act, or for the rest of his life, the first reaction is, I will not believe that. Every parent will go through that, and they will start to shop and try to find someone who will tell them something different. They would say, this doctor doesn't understand anything, let me see somebody else. The problem is with the parents who don't shop, because some parents just ignore the problem completely and say, no, he's going to recover, I'm not going to do anything. These are the problem, because if you shop, eventually you will accept, because if the child has a problem, apparently he will go from one doctor to another. Somehow you will still hear the same thing. The problem is a lot of people just ignore it. And then when they go to nursery, this is when the teacher comes and tells them, your child has a problem. Now, one of the problems we face is that what the mother does, she removes the child from the nursery. I want to tell them that that nursery teacher has done you a favor when she's telling you your child has a problem, because if you leave it, it will just grow. It will not go less. And if you don't help the child, the brain is growing the first 6 years like crazy. And everything we do to that child at that time will give you 100% result. So the early intervention is very important, because this is the time we are reconnecting the nerve cells together. And I don't want to use the medical word, but to make it easy, all our nervous system have centers, and these centers are connected with each other. And when a child is born, they are not too many, but they grow until the age of 6, and then they start to grow slowly. So we want to utilize that golden time for the brain development to teach the child as much as we need. And whether your child have autism or don't have autism, because a lot of children don't go with eye contact, and it might not be autism, it could be something else, and especially if they are below the age of 3. A lot of the symptoms of ADD, ADHD, intellectual disability, and autism look alike when the child is very young. Still, you still need to do something. You still need to give him the right programs to tackle where his delay is. So yes, denial is part of the journey, but it is the sooner the acceptance is the better. A lot of time we find that one of the parents accepts and the other one is in denial. It doesn't matter. As long as one parent is there, it's important that that parent start to work on the child. And then you will see results. And as you see that the child is developing and learning new skills and getting better, life just, you know, it becomes like a joy to your life. You become happy with everything that your child learned. But acceptance is a real challenge, and you have to be there. You have to, you know, believe in God and believe that these things don't happen. It's a test for your patience. It's a test for your belief and faith. And we have to support our kids as much as we can when they are very, very young, because this is the most important time.
Rightly said, Dr. Hibah, that this early intervention, early years, the first 6 years is the golden era. And if the intervention happens in the early years, the brain is into a formative way and the learning is much more faster.
Exactly. It's like a computer. You reset everything and you teach. We use ABA therapy. We use the speech and language therapy. You use occupational therapy, sometimes physiotherapy. You need to work on the muscles. You need to work on the language. You need to work on the receptive skills into the expressive language. We need to into comprehension language. They need to understand. They need to learn how to read. They need to learn how to write. They need to learn how to be independent. So there is a lot of skills we teach. And it's very important that the parent educate themselves when they are told your child has a problem. Start to read about it. Read, because there are a lot of successful stories. It should not be depressing. It should be inspiring to see, okay, this is what happened to me. Is I read about Temple Grant, and I read a lot of people who became successful in life despite the fact that they had autism, and that inspired me. I could not accept that my child will never be normal. I could not accept that, and I started everything I've done today because I did not accept. So not accepting is not a bad thing, but it's important that you take the right action towards recovery.
And I personally believe, Dr. Hibah, that labeling or tagging is not actually concerned. The thing is, if your child is facing any challenge, acceptance will only start the journey to support the child, which is very, very important. And believe it, your presence here has been really nice. And I'm sure our viewers, whenever they listen to this conversation, it's going to support them, motivate them, and certainly look into it to especially acceptance, because a lot of them who live with denial, I know it is heartbreaking, it is very, very difficult to accept it. But you rightly said that there are such lovely success stories. And when we look at that, we believe that everything is possible in today's fantastic, research-oriented, innovative, and amazing world. So a message going from all of you, from Dr. Hibah to all of you, is that, come on, let's be working like a team, accept whatever the challenge the child is facing, work together towards it, and any destination is possible, because we already have amazing success stories. Thank you so much, Dr. Hibah, for your valuable time with us this evening. And I'm sure it was a learning for all of us. Thank you very much. Take care. Stay connected.
Thank you very much. And thank you all audience. I hope that you have enjoyed our chat today. And I wish you, Dr. Aklaka, all the best, inshallah, and success in your empowering the determined mission.
Thank you so much. Bye-bye. Thanks, parents, for joining us. Thank you so much.